It's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. And today we're going to talk about treatment timing for your Invisalign with MA cases. A lot of you are really loving Invisalign with MA. I do love it as well. It definitely has its pros and its cons. You should definitely check out all the content I have about Invisalign with MA in my channel. You can search by keyword or go to the Invisalign playlist or the Phase 1 playlist. But remember, you can do Invisalign with MA in Invisalign first, which is Phase 1 treatment. That is straightening the front teeth only, as well as fixing the bite. Or you can do it in Invisalign Comprehensive, which is finishing all the teeth from 7 to 7, from second molar to second molar. And sometimes, you've got this patient and you're kind of in the middle and you're like, should I do this as Invisalign first or should I do this as Invisalign Comp? And that can be a tricky decision. And I see a lot of doctors getting themselves what I call stuck in quicksand, which means they are picking Invisalign first. Oops, bad call, because the patient is already starting to have mobility in their C's, D's, and E's, which are the baby molars and baby canines. The problem with having mobility, especially in the baby molars, is that there could be a period if you went off track and or if you started losing teeth of where you'd lose your retention, or you might be ineligible to do Invisalign with MA. You might be eligible to do it to start, like they're there but they're wobbly or they're about to fall out, but then you get off track for whatever reason, you go to do the refinement and you get rejected. And if this is an Invisalign first case, you only have 18 months to finish that case. There may be a little wiggle room in there, but you may not be able to finish it until all the teeth come in, because you can't do it if there's missing molars in the, or if you're missing premolars or molars, they will actually reject you from doing that in a refinement. I do have a video about the rules, and they're not trying to be rude or mean or anything like that. I mean, it's just logical. You got these wings need retention in order to work. So if you don't have teeth in this area right here, they're not going to let you use it. You can do regular aligners. Don't get me wrong. You can still straighten the teeth, but you may not have to do that. You may be only working on the bite at that point, or maybe it's a case that doesn't even need that much straightening, or maybe you already finished the straightening, So if you're within that 18-month window and oh no, you ran out of time, you're not going to be able to finish the MA, which means you're going to have to pay a second lab fee to finish the case. I've seen it happen, so it's just a bad choice. So anytime for me, unless you've got a solid 6 months to a year before you start losing these teeth, look at the panel, check mobility. I would always do these cases as Invisalign Comprehensive. I call these long comp cases or long comprehensive cases. I kind of made up that term a long time ago because we're like, okay, we're kind of in mixed dentition. We could do Phase 1, but because this is and maybe this was an expander case or just a 2x4 case, great. This would be a fine Phase 1 case, consolidate, straighten the front teeth, consolidate from 2 to 2, fix the bite, right? But if we need MA or growth modification, same thing happens if you have a twin block case. You really can't do it if you're missing the teeth in the middle or if they're loose because you're in quicksand, they're unstable. So I always recommend just treating these as long comp, which is comprehensive. Yes, I realize that's more of a lab fee, but it's actually better for the patient because hopefully you're picking these as the 5-year plan, not the 3-year plan. No, watch out with Invisalign 3, watch out. I don't even know if you can do that with MA, but that's tricky. I see people picking Invisalign 3 all the time and then running out of refinements, and they end up having to pay more lab fees than they would if they had just picked Invisalign Comp, and they still only get 3 years. They don't get the 5-year wiggle room, which is great. That's a whole nother thing. We won't even get into that. So pick the comprehensive option. It's actually really nice for the parents because now they're done. You're going to cover this patient for all their ortho needs until it's completely done. And then they're done. They don't have to do another phase later, which will actually save the parents money in the long run. Now, of course, this patient is 6 or 7 or 8. You can probably do Invisalign first as long as they're not having really advanced dental age. So pick your MA cases wisely. And remember, even if you've treatment planned it and then the patient hems and haws and comes back 3 to 6 months later, you may need to take another x-ray and see maybe they're not an Invisalign first case anymore. Maybe they started losing teeth. Maybe now it changes and they're comprehensive. So make sure that those estimates or those contracts are only good for 30 days. If they don't jump on it, then it's a new evaluation. It may change. It may change the treatment plan. It may change the pricing. You're not trying to get them or anything like that. It's just the right thing for the patient. Because ultimately, I end up seeing doctors that end up having to pay extra out of their own pocket because they chose the treatment plan selection from Invisalign poorly, and you really can't assess additional fees to the parents if you made a bad decision. All right, thanks so much.